today we're going to cover a little bit about what Bid for My Meds is and BidRx.com and how they work together to form a unique opportunity and a unique product to offer to consumers that or otherwise haven't been able to have something like this in the past. So this is a site called BidForMyMeds.com, and what you've got here is a description about something that's really big in the marketplace right now, which is prescription costs. This is the lowest priced prescriptions you'll find anywhere, period. That's what it says on the website. So there's an overview here about what we do, the system that we have developed, the company we have an exclusive marketing arrangement with has been featured on the NBC Today show. They've been featured on CBS, the Early News, the Clark Howard Show, News USA, NPR, CBS, Channel 13, that's in Milwaukee, Drug Topics with the voice of the pharmacist. But many other publications have this, so we can just put an overview there at the bottom. But basically, on the site, we talk about what this product will mean for prescribers. That's doctors and physicians assistants, dentists and podiatrists, people that have a DEA number that are licensed to write prescriptions to patients. And we cover, with this service, the lowest prices you'll find anywhere, we cover every single prescription drug sold in the United States. Okay, it's not just a limited list like our Walmart or Kroger or Target or any of those. They have, lists where they have 200 or 300 drugs. This is everything in every strength. There's a little bit about prescribers here. There's a little bit about our industry. I'm going to go into this in a minute, just some facts that we can support everything with. Consumer Reports has done an article on it that a huge percentage of people are sick because they're unable to take medications because they cost too much. A little bit about the competition. People have heard about discount prescription plans and there's discount prescription cards. This is not that at all. This is an electronic marketplace like Priceline or Kayak or Expedia where you put in a bid price for a plane ticket or a hotel room or a rental car and you let all the vendors for that particular item compete and you get the lowest price. So we're 40, 60, 80% less than all those guys. So it's not even close. So it's a real unique deal. And right now, with all the issues going on in healthcare, it couldn't be a better time. There's a little about us here. I'm going to go over some slides. Dr. Ralph Calise and Tom Kellenberger are the powers behind this. They have long careers in the healthcare and pharmaceutical industry. They both were involved in founding Medco, which became a $30 billion company and then sold out to Express Scripts, providing major corporations across the United States with their prescription drug plans. So these guys really know what they're doing. Matter of fact, Dr. Calise here is one of only 14 pharmaceutical clinical scientists in the United States. So this is really a unique opportunity because these guys. And then there's a business opportunity associated with this. It's really poised to help leverage this in a way like nothing else. It's a very low-cost subscription service is what it is. And through this business opportunity, we have set up a unique group of individuals that have built organizations of 200,000 and 300,000 sales reps as well as consumers in different companies. As far as I personally know, right now, the people that I have spoken with have probably had at least 1.5 million people in different organizations selling skincare, nutrition, and weight loss through direct marketing. We put together a business opportunity like that run through Bid for My Meds. And this is all powered by a company called BidRx. They're our strategic partner. They have a patented system. We have an exclusive business arrangement with them. So I'm going to talk about that for a minute. Before I do, I'm just going to walk you through some slides. Basically, what we're all about at BidRx, which is our exclusive partner, is prescriptions at a fraction of the usual cost. And it couldn't be better timing because what's gone on in healthcare already, besides all the things with Obamacare and the Affordable Care Act, is that a lot of people have higher deductibles. Their health insurance is costing a lot more, plus there's higher and higher deductibles, and a lot of companies aren't even providing prescription medication reimbursement. So couldn't be a better time. Drug costs have doubled in the last 10 years. There's a big percentage. Consumer Reports did an article on this about how many people are unable to purchase their prescriptions, and it's as of 2008, there was roughly 700,000 people a year that were hospitalized simply because they could not pay for their prescription drugs. So we're going to just talk about it. So prescription service to get prescription drugs at a fraction of the usual cost. That's what we're all about here. And it's every bricks and mortar pharmacy in the United States. No internet pharmacies. It's just bricks and mortar pharmacy in the United States and all U.S. manufacturers. So it's not some stuff that you're going to be scared about coming from overseas. And this is what the website looks like. I'm actually going to take you to the website in a minute, but this is patented. It's a competitive electronic marketplace like Priceline or Kayak or Expedia or Hotwire, but we have the exclusive patent on it, which is unique. And we show people what they should be paying for their medications. We open up the door for tremendous savings, things that people are not accustomed to seeing, and that's why Dr. Calise and Dr. Keller are so unique to have been the founders and developers of this technology. And let me jump here. We're actually going to do a live demo in a few minutes, but there's two levels of competition. You get to see what U.S. pharmaceutical manufacturers are charging, and then you get down to the retail level, mail-order pharmacies as well as corner store pharmacies like you have in every community down on the street corner. Well, guess what? You're going to see this and how it all comes together, and then you're going to see real live prices. As you can see, there's been a bunch of good CVS this morning, Clark Howard Show, and so forth. A lot of good resources. Reader's Digest recommends this. Colonial Life, the state of Ohio is using it in different departments. The state of Wisconsin is using it in their Medicare department. So this is the real deal. This particular price comparison we did is really designed just to show people the prices. But what's really unique about the system is you're able to go and try it free with a guest password to see all this working for real. Not like you could save this or you get this much of a discount. That's all a bunch of baloney. Okay, if someone says you get 70% off, that means nothing. You don't know what it's off of, so it's worthless. We're showing you the real prices people are paying, and you can go look it up. My mom, for instance, I looked up 6 medications she's on. She's 84 years old, just moved in a retirement community 2 months ago. And on one medication, our system gave her roughly the same price. But on 5 others, we save her $110 a month. So my mom says, where do I sign up? It's that simple. It's like $110 a month I put in my pocket. So they can see what they get to put in their pocket. So here's a price comparison. Here's a statin drug. This is the generic, by the way, for Lipitor right here. Not that you care, but it's $830 a year at Walmart. Lipitor is a big-time drug. Our pricing system allows you to purchase that. And by the way, this is a full year supply. It says Walmart, 12 months. BidRx, 12 months, annual savings. We're looking at $830 a year for Lipitor, the generic form of it. On BidRx, it is $80.71 for the entire 12-month period. Annual savings, $750. That's 90%. And we just go right down through them. And Walmart's one of the stores that has that $4 a month plan where you can get 200 or 300 different prescription drugs for $4 a month. Well, you can see 3 of these 6 medications listed here, or 7 medications listed here, $40 here, $40 here, and $40 here. That's for an annual supply. Well, guess what? Look at where we're at. $9.61 versus $4. $5.23 versus $40. Look at the cost savings here in this last column. When you add all these up, it's an average of 84%. This particular couple was spending $1,414 a year on their medications from Walmart, who's considered to be the big discount leader. And this is with co-pays and everything. You can wind up paying a lot of money, even if you have decent insurance, like my mom has United Healthcare insurance, and she has Medicare Part D because she's 84 years old. Well, you see, this out-of-pocket cost goes from $1,414 to $160, okay, which is an 84% savings. That's serious money. And the best thing about this system is you get to go to it and use it with a dim password to get in to find out what you will pay. You actually take your prescription bottle and type in the dosage of everything, and you'll find out, hey, this is what I'm paying now. You're going to know exactly what the results are. So it's not some sleight of hand trick. This is a website, Lowest Med, and you see all these percent saved, 46%, 11%, 70%, 86%, 90%. So really good savings compared to some of the big websites where they focus on this, and we're going to do a live demonstration in a minute. Here's the 2 gentlemen I talked about, Dr. Ralph Calise, founder and CEO, pharmaceutical clinical scientist, only 14 of these guys in the country with this type of background. He has a doctorate in pharmacy administration, former PBM owner, PBM means Pharmacy Benefit Manager. And those are the big companies like Medco, Caremark, which is owned by CVS, the chain of stores like, they're a competitor to Walgreens. CVS owns a company called Caremark. So it's CVS Caremark. They're a PBM. Express Scripts, headquartered in St. Louis, Missouri. Huge company. They bought Medco, which is a PBM. And you see all kinds of shenanigans with PBMs, price fixing and getting sued. If you just look up PBMs on Google, you'll find out all kinds of massive lawsuits from state attorney generals because they're overcharging. So I'm going to move on to the next slide. Former Health and Human Services Secretary Tommy Thompson, who was also governor of Wisconsin, is on board with this and involved as an advisor to the company. And he really, their industry, he's no lightweight when it comes to this. There's recent testimonies here about how someone saved $300 a year or a month or whatever. I won't spend a lot of time on those. Here's another discount pharmacy comparison. This is MedSaverCard.com or NACO.org. These are different pharmacy discount programs. We're saving them anywhere from 30% to 95% off of their prices. Azithromycin is Z-Pak, amoxicillin, Amoxil, Laerotid, a bunch of trade names that amoxicillin is sold under. Really common drugs. When kids get a flu and colds, doctors prescribe the little pink, the pink liquid, and that's amoxicillin in some different form or another normally, or they get the earaches. Here's another one, prescription price. But let's go up to where you can see, we're going to log in. This is the engine that powers Bid for My Meds. So Bid for My Meds right here that I showed you a minute ago is the portal for the distribution system, and we have a patented product with BidRx as our engine, and we a unique and one-of-a-kind business partnership with Bid for My Meds. They are the engine that runs this. And through Bid for My Meds, people can enroll in the month-to-month subscription. They cannot enroll here. They have to come through another source like a state agency. So taking this out to consumers is what we're all about. You don't have to be part of a state agency now. You can go to Bid for My Meds and register here as a savings partner or as a referral partner. So you get the savings benefit as well as you're paid for the referral of other customers through our unique compensation system. So I'm going to go to this here, and you can see I'm going to type in guest 1 and RX demo, all lowercase. Okay. So you can do this yourself later. I'm on the live website. And so I'm logging in right now, and you're just going to see it work real time with a drug. Let's say start auction. I'm going to skip all this other stuff. By the way, pharmacies can all join for free. You can let physicians and nurses and other caregivers, maybe a family member, come in and look at all your medications if you need help. With this system, you can click and get a little code to send out to people. So we're all what's called HIPAA compliant. The healthcare administrations in all 50 states make sure that no one's stealing someone's drugs or doing any stupid stuff with regard to medications because it could be life-threatening. So you can issue your physician, for instance, if you're on this system, you can issue them a code with a click of a button, and they can log in and see what you're on and how much you're taking and maybe adjust your dosage or whatever things are necessary. And by the way, the filling of a prescription with this system is identical to what you do now. There's no change there. The doctor writes you a script and you give it to the pharmacy. Or they can do an e-signature, which means it's just automatically emailed through the internet to a pharmacy. Okay, same thing, nothing changes. If you have the prescription in your hand, you can fax it to the pharmacy. You can tell your doctor's office to call the pharmacy. Same thing that you've always done, so no change there. We get a lot of questions on that because people think there's some hoops you got to jump through. There's nothing different. So I'm going to hit start an auction, and I'm going to just pick up a well-known drug. There's a lot of them here. These are the most popular drugs, by the way, used by patients throughout the United States. 75% of all Americans, that's men, women, and children, have taken a prescription drug in the last 6 months. So it is a big business. It's about $400 billion a year. We have all drugs listed alphabetically here, and there's also a lookup screen here. So we show the most common ones here, like my wife takes Nexium. She takes nortriptyline as well, which is something to get rid of headaches. And I've looked those up, and my wife saves about, we have good health care coverage with Aetna, she would save about $50 a month with this. And you might know this, but we're turning the system on now, so she will be using it, my wife Debbie. So let me go here and just click Lipitor, because it's the best known drug for the reduction of cholesterol. It's made, I think, by Pfizer, one of the big companies. Products matching Lipitor, and here's Lipitor here, and it says another product with the exact same ingredients. That's a generic, atorvastatin calcium. Well, I'm going to click on Lipitor. Let's say my doctor wrote me that. And it shows me, and this is connected to all the pharmaceutical manufacturers, it shows me there's 4 different strengths, so I'm going to pick 20 milligrams. And I want to see what this is going to cost. I'm going to make the system do a bid for me. So I'm going to put in 360 days. Okay. Or 360 tablets for 360 days, and the system will automatically do the math. I could type in however it was written by the doc here. And I'm going to put brand required. I'm going to hit next, and guess what's going to happen? I'm going to see, the prices here. This is the first level of competition. If I was paying the standard price that PBMs are charging for this is $2,500 a year, which is $200 a month. So it's an expensive medication. Now, right away, without even getting the bids, I can see that I can use a generic form of it here, and they show me generic equivalents as well as the generic form of atorvastatin calcium right here, $79. This is for a year's supply. Imagine that you're on a $20 a month copay. You'd be paying $20 times 12. That's $240. Well, you could spend $79. But we're not done. We've only done the first level of competition. I say get instant bids. And, it says, current auction. Okay, I'm sorry. I have a current auction for that. I went in and let me go and cancel the auction. Well, what I need to do, basically this drug, if you go through the process, I did a demonstration with this and I already reserved this, but basically with this particular drug, you get down to, there you go, you can see what we would pay. $24.23. That's for an entire year's supply. And not only that, they deliver it to your door for free if you use one of the mail order pharmacies. So you don't even have to drive anywhere. Also, if you have an acute illness, you obviously can't wait for it to be mailed to you from some pharmacy, and you don't know what pharmacy across the United States is going to win the bid. So what we have is a printout where you can print out your prescription and take it to like Walmart or Kroger's or there's most of the big chain grocery stores have pharmacies, and they do price matching. So you can bring it to Walmart and say, hey, this is $24. I got to have it right now. Now, obviously a cholesterol medication that wouldn't happen with, because that's a maintenance type drug, or Nexium is for acid reflux. That's a maintenance type drug. But let's say you needed a Z-Pak, which is a real strong antibiotic. If you're really acutely ill, like let's say you got walking pneumonia or something, and doctor gives you Z, you can go down to your local Walmart and they'll do a price match. By the way, instead of $100, you pay $4 for it on our system. You show it to the Walmart pharmacist, they have their price match guarantee. It's just really a powerful service, whether you're picking up your meds locally because it's acute, if it's a long-term thing. $24 a year for Lipitor, I mean, come on, that's what, $2 a month. Delivered. That's for a year's supply. So very, very powerful system. There's nothing like it out there. It's not just another pharmacy program. And I've had Anthem Blue Cross. I've had United Healthcare. I've had Aetna. This is over the last 25 years. And I've had one other one I can't recall. These prices that you can buy the drugs for here are a third or a fourth of what the copays are. I can't tell you how many times I've driven through a Walgreens store or a CVS pharmacy here in St. Louis where I'm located and picked up a prescription, pick up 2 prescriptions, and it's $40, $20 copay on each of them. And the plans vary a little bit from United to Aetna to Anthem Blue Cross, but they're all pretty similar. This is so much cheaper. So if you have no health insurance, if you're on Medicare Part D and you're responsible for picking up part of it, if you have a high deductible plan, which everyone's getting shoved onto, this is a godsend, this service. And it's 75% of people in America, of all people, have taken a prescription drug in the last 6 months. So you combine that with a blockbuster business opportunity where you share this with other people and you can earn a professional level income. It's a very simple system, not all this gobbledygook about you have to do this and this and this. Very, very simple. Just refer 5 people, like you tell people about the new Hunger Games movie, like someone told us last night, you got to go see it. So we're going to go when there's no crowds. But here's an example of that. You share it with like a movie or a restaurant with 5 people, and all of a sudden you're participating in a compensation plan that as it grows, as that little group of nucleus grows of people that are interested and maybe others interested in referring others, you've got a system here that's unlike any other business opportunity in that you can see what it's going to do in advance. you see business opportunities for weight loss supplements. Well, imagine that there was a new business opportunity for a weight loss supplement where they said, we guarantee you're going to lose 20 pounds this week if you pay us $50 to buy this pill or whatever they've got, some drink. Guarantee you're going to lose this weight this week. They couldn't make enough of the stuff, whatever they're selling, as long as it didn't hurt you. Well, that's the way this system is. This is the first business opportunity I've ever seen. You can see the results in advance, and you're actually putting money in your pocket instead of spending money that you didn't intend to spend. That's the most exciting thing about it. I come from the medical background. I work for Bristol Myers Squibb and Beach. So I know the hospital injectable antibiotic scene. I know all the retail pharmacy scene. And there's never been anything like this. So it's exciting, and we're excited about what's happening here. So thanks for joining us today. Bye-bye.